Dr. Deborah Birx said this about the administration response during a recent interview with CNN.
There were about 100,000 deaths that came from that original surge. All of the rest of them, in my mind, could have been mitigated or decreased substantially.
With us now is MSNBC medical contributor and former Obama White House health policy director, Dr. Kavita Patel. It's great to see you as always. And let's start there with what we heard from Dr. Birx. She's basically saying that more than 400,000 deaths in this country were effectively preventable. What's your reaction to that?
Yeah, Jeff, good to be with you. And honestly, it's depressing and distressing, and fill in any adjective that kind of is similar, because it's exactly what we've worried about. And now not only is she reinforcing it, which I have to say, it's a little, for all those people who have unfortunately died and their families, and as well as people who have been sick, it's a little bit too late to hear that. I appreciate the message, but it is distressing and validated also, Jeff, in other studies. So it's consistent with what we've heard from epidemiologists and other public health officials.
I want to ask you about the present day, because right now you have the CDC director, Dr. Rachel Walensky. She's warning that the U.S. could be on the cusp of another surge, because as of right now, COVID cases, according to the numbers nationwide, they've climbed by more than 7%. And we are recording a 7-day average of about 57,000 new cases per day. And so putting that in context, on January 11th, at the height of the surge, that 7-day average clocked in around 250,000 new cases per day. So looking at all of these numbers and sort of unpacking this data, how much time do you think we have to control the current uptick in cases before we could see another sort of surge again like this?
Yeah, it's interesting, because the real kind of conundrum here is that we are doing, as you kind of brought in the intro, an incredible job with our vaccination pace, so much so that we're leading many other countries, foremost the EU and other developed nations. So without that vaccination pace, Jeff, we would 100% see not just a surge kind of like the Christmas time or holiday time, but potentially even worse because of these new variants, not only the ones from outside the United States, but especially concerning inside the United States. So what we're looking at, though, with the continuous pace and President Biden's goal of 200 million by 100, is that we're likely going to continue to see increases, and also to level set, the number of new cases, as you point out, still rivals what we saw during the first two waves, Northeast, West Coast, and Midwest, which is exactly where we're seeing increases in cases now. So I think that if we can continue with this vaccination pace aggressively, we'll blunt that a little bit, Jeff. But make no mistake that now we're seeing younger people in the hospital, because the majority of older people have been vaccinated. So they're not hospitalized, they're not dying, but we're seeing younger people, and that's alarming. And then we're also worried about people who can't get vaccinated because of logistics or distrust or for whatever reason. They're getting potentially a second infection because their immunity has waned over the course of the last year plus. So I do think the next 6 to 8 weeks are going to be critical. And then hopefully we will have vaccinated the majority of people and gotten past, I think, the most critical threats from any surge of this size.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.